Good morning, members of the media, members of the country, the public. Thank you for joining us, the Governing United National Congress, for our second press conference of the new year. On Sunday, we came to you to speak on national issues, and today, Wednesday, we come to you again as we continue the journey of rebuilding our country, of creating a safer society, a stronger society led by the Honorable Prime Minister, Dr. Kamala Persad-Bissessar. This morning, we are joined by two stalwarts of our party and government. We are joined by Dr. Tim GOPEESINGH, the chairman of the NCRHA, as well as Senator ELI ZAKOUR, Minister of Transport and Civil Aviation. And this morning, it is my pleasure to introduce Minister ZAKOUR to the program as he speaks to you on the government's agenda on creating a safer country and safer roads. Let's welcome Minister ZAKOUR, the Minister of Transport and Civil Aviation.
Thank you, MP Morris. Good morning to the viewing and listening public. Today, I would like to address misinformation in the public domain on a couple of matters and share the work we are doing at the ministry to improve road safety. First, I would like to touch on the driver permit renewals. The fees for driving permit renewals has not been increased. However, the fine for late renewals has been increased. These fines are not new. Last year alone, in the last financial year, we received $5 million in late driving permit fees and $9 million the year before. So this is not new. Under Section 61A, persons driving 6 months or less was $350, is now $650. 6 months and less than 3 years, it was $875. Now it's $1,750. And 3 years and less than 5 years was $1,750, is now $3,500. The Transport Commissioner would have put out a press release yesterday indicating that on Monday, some persons paid a less fee. This was because of an administrative error where the programmers entered the figures incorrectly on the system. This has since been addressed. A lot of persons in the public domain are asking, when was this increase done? Because they did not see it anywhere, including members of the media. I am holding here the Finance Bill 2025 that was debated in both houses of Parliament on December 5th and December 9th. Section 61A, right here. This was debated in Parliament, and I actually spoke on this as well on December 9th. Currently, we are experiencing some system challenges at license offices where the system is going offline. Yesterday, it happened a couple times, I believe for about 6 or so minutes in one instance. This is being addressed, but this is a system that we inherited. The reason why we're experiencing long lines at the various license offices is persons are coming to transfer their vehicles that wasn't done within a legal time frame, and persons are coming to renew their driver's permit that was not done within a legal time frame. That's causing the influx along with persons who are coming within a legal time frame. I would like to remind members of the public that under Regulations 20, you could renew a driver's license up until 30 days before expiry. And I also want to let the public know that driving with an expired permit is extremely serious. Your insurance policy, one of the requirements is having a valid driving permit. And if you're in an accident without a valid permit, the insurance company could deny the claim and also cancel your insurance. So this is very, very serious. And in the last 2 days, close to 1,000 persons have came into license office to renew their driver's permit that should have been done within a legal time frame. We are seeing in cases where persons months and even years overdue. So we're encouraging all members of the public to please renew your driver's permit within a legal time frame. You can't do so online, which is light motor vehicles and motorcycles can be renewed online. Currently, you cannot renew your driving permit online if it has expired, but IT is working to address this currently. We are also experiencing long lines because persons are coming to inspect their vehicles. I'd like to remind the public that on January 5th, the inspection station's mandate has been expanded. I would have put out a couple press releases in the last week. Public service vehicles, which are vehicles for hire with a tare weight not exceeding 2,270 kilograms, could go to the over 77 inspection stations, including VEMCOT, and goods vehicles, which are trucks and trailers exceeding 3,200 kilograms max gross weight, can go to VEMCOT. The public service vehicles alone, this would be 65,000 vehicles less coming to the various license officers with public service vehicles alone. I would like to touch briefly now on the merit points system. There's a lot of misinformation in the public domain. I'd like to put a couple of things on your record. There is no evidence that proves that this system worked. The evidence shows the opposite. Road behavior remained unchanged. When I entered office on May 3rd, 2025, 973 persons were disqualified from driving. 706 were due for rehabilitation under Section 88N3 of the Motor Vehicle and Road Traffic Act. Over 9,700 persons had received letters of intent to disqualify, and 9,000 persons had qualified for disqualification, but the process had not yet commenced. When I saw these figures, I was shocked, because if you're disqualifying persons regularly, this figure will not be so high. But the previous government had no intentions of disqualifying anyone. The previous Minister of Works and Transport on April 8th went on national television 3 weeks before the general election and said that the government at the time reviewed the demerit point system in 2022, 2024, and further review by cabinet. They indicated that persons will no longer be disqualified. Once you reach a threshold, you will have to do a rehabilitation program. This government started that rehabilitation program on April 18th, 2025. Since then, over 250 persons participated. That's an average of 77 a month compared to 21 before, when persons had to go to 2 entities and pay over $1,000, a 3-fold increase. These 2-day sessions are held at Caroni, Port of Spain, San Fernando, and Tobago with an 85% pass rate. Okay? And also, this is also free of charge. Online certified copy system. Currently, persons can go online to renew their certified copy. You no longer have to go in to the various license offices. You could choose to collect at TT Connect locations, or you could choose for delivery at your home. Very soon, we'll be launching the online fixed penalty system, where persons can pay their fixed penalties in the comfort of their home or office. We are also installing new road signage across Trinidad and Tobago, across all highways. PTSE. Now, public transport plays a critical role in promoting road safety. PTSE was left to diminish and decay under the last administration. When we assumed office, 79 PTSE routes have been discontinued, under 100 buses. Over $100 million paid in security, over $100 million in parts spent in just 5 years, and still nothing was solved. This government is working tirelessly to address all the issues affecting PTSE. Restoring police vehicles. In 3 weeks, the government of Trinidad and Tobago, under the Prime Minister, Mrs. Kamala Persad-Bissessar, SC, handed over 52 restored police vehicles to the Trinidad and Tobago Police Service. The last batch handed over on Christmas Eve. Some of these vehicles were parked up at private garages for up to 2 years. There was one vehicle parked up for 2 years that took 2 days to fix, and one vehicle parked up for over 1 year took just a few hours to fix. And this program is ongoing. We'll be rolling out and handing over more police cars very soon. All that we are doing is to improve road safety, ensure compliance. And I make no apology. We are doing this to save lives. The opposition is against the increase in fines and what we are doing. And the opposition, within their right to oppose, that's their job. But why would you oppose measures to save lives? In Senate, I had to ask the question, if the opposition themselves were objecting because they did not want to pay the higher fines if they got a ticket. This is to save lives. Several weeks ago, I attended the Arrive Alive Remembrance Walk at the Queen's Park, Savannah, walking with families that would have lost loved ones on our nation's roads. And I had an opportunity to sit with many of the families, and they would have shared their stories. Many persons lost their parents, many persons lost their children. I met one gentleman who lost 5 members of his family in one accident a few years ago. We are doing this to save lives. And before I close, and we'll take questions at the end, I would like to just go back to the demerit points, if I may. The demerit points came into effect in May of 2025. Sorry, May, my apologies, 2020. 2021, 2022, 2023, road fatalities increased. And 2024, it went up by 22%. The demerit point system did not work. It penalized some and did not others. There were persons with 12, 14, and 15 demerit points being disqualified, and some with over 150 and 200 that were not disqualified. It was a very unfair system, and this government had to act and address it. Hence why we removed the demerit points from 69 of the violations in the 9th schedule. However, it remains on 6 of the criminal offenses. I would now close and I will answer questions at the end. Thank you.
Thank you very much, Minister Zakour, the Minister of Transport and Civil Aviation. We'd now like to, this government has been making significant strides in improving the healthcare system and the health services offered to our country. One of the individuals undertaking that task together with the Prime Minister and the Minister of Health is Dr. Tim GOPEESINGH, the chairman of the NCRHA. He's a former member of parliament, a former minister, and a well-known, well-respected and well-loved health practitioner in this country. Let us welcome Dr. Tim GOPEESINGH, the chairman of the NCRHA this morning.
Thank you very much, Honorable Minister Nicholas Morris. Good morning and Happy New Year to everyone. I extend best wishes to the people of this nation for a productive, very healthy, successful and purposeful 2026 and beyond. As we all are aware, a new year carries with it an expectation as I am speaking now, an expectation of us in the health sector for responsibility and leadership, particularly from those of us entrusted with institutions that affect people's lives every day and people's health, like the NWRHA, NCRHA, the Southwest Regional Health Authority, the Eastern Regional Health Authority, and the Tobago Regional Health Authority. I wish to acknowledge the strong and decisive leadership of our Honorable Prime Minister, Mrs. Kamala Persad-Bissessar, whose vision, compassion, and brilliance, and whose insistence on accountability, transparency, and integrity has set a clear standard for how public institutions, and importantly, as well in the healthcare, must be governed. It is in that, or this spirit of duty to the public that I address you this morning. Why am I here? Why are we in the health sector? It is about people. My presentation today is not about politics, personalities, or paperwork. It is about patients and citizens' health and citizens' lives. So it is about people. It is about the 600,000 to 700,000 citizens in the central and the eastern and northern part of Trinidad, and sometimes patients from the western part, who depend on the North Central Regional Health Authority for medical care, emergency services, clinics, diagnostics, surgery, and follow-up treatment. Citizens of the population, we see approximately 500,000 visits to our 15 health centers that the NCRHA governs. We have about 500 citizens coming to emergency departments of EWMSC, adult and pediatric, and Arima General Hospital. So all of these from the NCRHA, 500 daily in the emergency departments, out of which we have to admit between 70 to 100 on a daily basis. But let me just take you back to the last 10 years. In that decade, many citizens were failed, and you saw it very plain during the COVID pandemic. They were failed not by doctors or nurses who continued to serve the citizens, sometimes under impossible conditions, but by a system weakened by endemic corruption, chronic mismanagement, reckless overspending at the governance level. Ladies and gentlemen, members of the public, in just the NCRHA alone, we do 50,000 CT scans on a yearly basis, approximately. We do 4,500 MRIs. These are the most sophisticated investigative procedures. Do approximately 20,000 ultrasounds and 170,000 X-rays. So what did the public experience? And what did the public experience over the last 10 years from 2015 to 2025? And the human cost of mismanagement. As you all are critically aware, citizens experience long waiting times in accident and emergency, experienced postponed surgeries, sometimes for 2 to 3 years, overcrowded clinics, shortages of equipment and supplies, broken down infrastructure and facilities, delayed diagnostics, and exhausted and demoralized staff. These were symptoms of a continuous systemic failure. Every dollar wasted at the governance level meant fewer resources for patient care. Every contract inflated or improperly awarded meant less funding for medicines, maintenance, staffing, and frontline services. Mismanagement at the top always lands hardest on patients who are relying on the healthcare. So what we found when we came into office as the chairman in August and the board in August of 2025, just about 4 months ago, what we uncovered was not simple inefficiency or isolated error. It was a sustained collapse of governance over the last 10 years, a lack of accountability, financial fraud and mismanagement, widespread corruption. Financial discipline had been abandoned. And I will go on to show you pretty shortly what I am saying that will substantiate my statements here. Procurement systems were compromised. Oversight was weak or ignored. I'm speaking about these during the last 10 years. Enormous sums of public money were spent with little or no transparency and accountability. Well, of course, the result was predictable and devastating. Thousands of citizens died needlessly in hospitals. Thousands suffered long and agonizing time waiting for for their care. So resources were diverted away from patient care. Hospitals were operating under financial strain and operational inability. So let me give you some financial statistics. When we came in August last year, 4 months ago approximately, there were 546 suppliers to the NCRHA who were owed $321 million. And that is, after 10 years with different boards and spending close to $1.4 billion a year for 10 years approximately, so $14 billion spent by one authority, NCRHA, 546 suppliers was still being owed $321 million. In the short period of 4 months, we brought those amount of suppliers down to 120. And so we paid over $150 million in a 3-month period. And we have the information here. I have the top 20 suppliers trade payable as of July 31st, 2025. And some of them were owed 15 million, 11 million, 10 million, 11 million, 16 million, 13 million, 29 million, and so on. So 521 suppliers owed millions of dollars. Let me go on to the period of 10 years, from October 1st, 2015 to July 2025. Payments made to suppliers during that period of time was $3,242 million. And of this $3,242 million over the 10-year period, payments made to the top 20 suppliers total $1,856 million, representing 57% of the overall payments issued during this period. So top 20 suppliers were paid $1,856,000,000 over a 10-year period. So the top 20 suppliers received at an average $180 million a year for the 10 years, 180 million for the 10 years. I have the companies that received 8 companies. The top 8 companies received $1,220,000,000. 1.2 billion were received by the top 8 companies. How much that approximates? About 150 million per year. 150 million for the 10 years to the top 8 companies. And why should that be? Because there are a number of irregularities and a number of issues which confronted, which brought on that. And one of it was major corruption. So I have the names of the companies. One company received 228 million in 10 years. Another 224 million. Another 151 million. Another 144. A cleaning and maintenance company, 129 million. Another security company, 124 million. Another top company in Trinidad, 115 million. Another security company, 107 million. So these 8 companies, which were preferred companies by the executive management and by the North Central Regional Health Authority Board and management, had preferred, and 8 companies benefited immensely, millions of dollars. And I repeat, 8 companies benefited to the tune of $1,220,000,000 over a 10-year period. Approximately 150 million each of these 8 companies received. And I just gave you the figures for these top 8 companies. And for the top 20 companies, they received $1.856 billion. And what does this speak about? What we are speaking about is grounded in documentation. And since June 2025, we commissioned internal reviews. We initiated forensic and compliance examinations. We examined contracts, payments, and approval trails. We engaged auditors and technical experts. And within the last 5 months, the board has acted decisively in the context of what we met in terms of the financial quagmire and corruption. We have stabilized finances, imposed strict expenditure controls, halted irregular practices. We reformed procurement. We strengthened governance and internal controls. These actions are already redirecting resources back to where they belong, patient care. This is not cosmetic reform, ladies and gentlemen. It is structural repair undertaken so that hospitals function better. The 5,000 workers within the institution, approximately 1,100 doctors, 1,100 nurses, 400 patient enrolled nursing assistants, and so on, so that they continue to deliver more efficiently in the clinics, in surgery, and patients receive better health care, which they deserve. Let me just expose some of the major corruption issues that we inherited. We inherited issues like janitorial contract. We were able to save at least 16 million approximately per year in janitorial contracts for one company and 2.4 million in another, 18 million. We saved over 3 million in ground maintenance. We saved $16 million in overtime. Overtime per year was about $90 million, well orchestrated within various departments so that overtime could be paid on a willy-nilly basis without any accountability. Almost $90 million was paid in overtime. We brought that down to about 15 million, 16 million. Wellness initiative programs, about 4 million per year was spent on wellness programs. We don't know where the money was spent, in what areas. You would remember there was a garden project in the front of the southern part of the Eric Williams Medical Sciences Complex. Within 15 months, that cost the country and the taxpayers $4 million. Well, we closed it down immediately. We had cancellation of purchase orders issued prior to July 31st, 2025, that suppliers did not fulfill, and we were able to save about $60 million from that. We were able to save as well, ladies and gentlemen, from consumables usage and engagement of additional suppliers and negotiation with existing suppliers. We renegotiated and we brought in new suppliers to be competitive with the other ones who had a monopoly of $36 million we estimate that we would save. So the authority, we anticipate to realize savings in the sum of $158 million through these initiatives. And these savings will be redirected toward the acquisition of critical medical equipment, infrastructure upgrade projects, and patient consumables. So just let me, as I end my presentation, we dealt with the unchecked financial overspending. We dealt with security and outsourced services. We dealt with the collapse of internal controls, and we are dealing with the institutional cultural failure. So in our short 4 months, there were a number of areas that we were able to implement with rapidity. We met a hospital, Eric Williams, that had one transformer. And if that transformer blew, the entire complex would have gone black, and patients in the intensive care unit and in the operating theaters, their lives would have been compromised. There was a transformer that cost $6.6 million that was sitting for 2 years, and absolutely nothing was done about it. We implemented and put the transformer in over a weekend, where we had to redirect some of the electricity services. 3 standby generators were not functional. We made sure that they were done. A chiller, there are 3 chillers that supply the Eric Williams Medical Sciences Complex with cooling. All 3 chillers were down. One chiller costing about $10 million was bought about 9 years ago, sitting and getting rusty and never used. So we're now in the process of getting that chiller done. The wastewater system was not being treated, and raw sewage was going into the mainstream of the water system for years. There were 9 pumps that we repaired immediately, and we sorted that problem. The freshwater system in the hospitals had no filtration. We put in filtration systems and we got that going. The fire hydrants are there, the 9 pumps that supply the fire hydrants, none was functional. We in fact now dealing with that matter. Lights around the car parks and the system, 170 lights were repaired and brought back into reality. Hundreds of blown bulbs and so on. Eric Williams Medical Sciences Complex, ladies and gentlemen, is about 40 years old. It was completed about 1985-86. I was a lecturer in the women's hospital next door from 81, and I saw that complex constructed during my time. So the complex is about 40 years old. There are 14 lifts. Not one elevator or lift has been repaired. Not one. When we went in there, 2 lifts were functional. Over one weekend, no lift was functional. Beds, hundreds of beds need to be replaced. We are now replacing 100 of these beds. Wheelchairs, trolleys, 580 broken down chairs where patients sit on. The place was filthy. Out of the 8 operating theaters, only 3 operating theaters were functional. Only 3 out of 8 operating theaters. So surgery wasn't being done. Air condition for the ICU and HDU was never there at all. We put in new condensers and so on. So the ICU and HDU units now are cooled. Operating theater tables, two theaters have broken down operating theater tables. No operating theater lights in some of these. The surgical instruments are missing. Some are non-functional. 3 boilers for the laundry and producing steam, all were down. We have got 1 and a second one repaired as well. The incinerator for waste, hazardous waste, was down for years. It cost $20,000 a day for the biohazard waste to be incinerated. We spent millions of dollars on that on a yearly basis. Now it is functional again. The kitchen is in a dilapidated state. So colleagues, ladies and gentlemen, members of the media, let me just end by giving you some of the findings of an internal audit done on janitorial and security services. Audit result. Audit found no evidence of valid formal contracts between the NCRHA and the external providers for cleaning services. Suppliers have been continuously providing janitorial services on a month-to-month arrangement for several years without written approval. There was no evidence of board approvals for the provision of additional services by the external contractors beyond the original scope. Over the past 7 years, 2018 to 2024, total payments to one cleaning company exceeded $59 million. This is an audit on janitorial services, while payments to another cleaning company exceeded $111 million. That cleaning company received timely payments as opposed to other suppliers. The managing director of that cleaning company was also the managing director of another industrial supply company supplying equipment and so on to the NCRHA. They received millions of dollars in payments annually from around 2021. Payments to this cleaning company escalated during COVID due to the extension of services at the Couva Medical Facility and the Arima General Hospital. Audit noted that annual payments remained substantially high. Also, also other issues. Audit found no evidence of valid formal contracts between the NCRHA and the following external providers, and they named 5 or 6 external providers. No evidence of board approval for the continuation of services on a month-to-month basis was provided for adult audit scrutiny. So, ladies and gentlemen, these are just some. I would not have the time to go into all, and in fact, the security companies and so on, and they continue to make the statement, this company received exorbitant payments for above any other supplier providing cleaning services to the NCRHA and so on. So why does this matter, ladies and gentlemen? Today, I am placing these facts on the public record because people deserve the truth. Healthcare is not a privilege. It is a public trust. The board will not shield failure. All the 4 boards under the direction under Minister Lakra Bodo and Minister Rishi Sitaran, and of course, mandated by the Honorable Prime Minister, no board will shield failure. We will not excuse corruption, and we will not allow, well, the authority under which I am chairman, this authority, to ever again be misused at the expense of patients, staff, or taxpayers. What comes next, ladies and gentlemen? Continued accountability to the public. This media conference, from my perspective, what I'm speaking, is not an endpoint. It is a starting line. In the months ahead, we will continue forensic reviews, finalize audit findings, and regularize systems that were allowed to drift for far too long. The public will be updated in a structured and responsible manner. And we will have our public exercise in about 3 months' time. Where matters warrant escalation, they will be escalated. So our commitment is clear: transparency, accountability, delivery. The era of squandermania, as our Honorable Prime Minister repeats on a daily basis, the era of squandermania is over. If the North Central Regional Health Authority alone, one of the four, can save approximately 150 million per year out of the 350 million we use for other things. This concludes what the Prime Minister has been telling the country, what the Honorable Prime Minister. If we save this money and we do not waste by corruption the millions that have been flitted away over the last 10 years, we will be able to govern this country comfortably by the money we save from all the wastage and corruption that had been done over the last 10 years. So the era of discipline, integrity, and patient-centered governance has begun again. This board will report on progress step by step as the work continues. Ladies and gentlemen, those are some of the facts, and they stand. I stand by them. And we will now take your questions, both Minister Eli and myself. I am available for any question. Thank you very much. It's an honor and a privilege for me to give this to the nation of my stewardship for the last 4 months as chairman of the NCRHA. Thank you.
Thank you very much, Dr. GOPEESINGH. Members of the media, those joining us, again, citizens gave this government a mandate to create a safer, more secure and stable society. And based on this press conference and the information presented by Minister Zakour and the chairman of the NCRHA, Dr. GOPEESINGH, that is exactly what this government is doing. So now I invite you to pose your questions to both members of today's press conference. I'll start with Jesse. Yes, so Jesse.
All right, thank you so much for your time, Minister Zakour. Happy New Year to you and yours, Sir Jesse Ramdale, CNC3. I just want to preface this question based on some context, right? Now, the UNC's campaign promises featured, reductions in traffic fines, among others, and you would have suggested that the previously existing demerit point system did nothing for road safety. And while we understand that reducing road fatalities is important, could these increases not have been ruled out after perhaps like a moratorium? Was there any sort of consideration for a grace period? And also this period would have, allowed for systems and infrastructure to handle the demands that we're seeing now. And I ask this because I circle back to what was said on the campaign trail about, reducing traffic fines, etc. What's your thoughts on that in terms of how it was ruled on a time frame, which is now, putting some pressure on citizens as we're seeing?
I'd like to touch on what you mentioned first. On the campaign trail, we did not have access to the operational data, the statistical data. But since assuming office, we have access to all data. And the lawlessness is worse than what we thought. So the government had to act decisively and put measures in place to protect lives.
In terms of the feedback that you're receiving, Minister, there's a lot of persons who are arguing that, it's difficult for them, especially coming out of a period of, some economic hardship, What's your message to those who are struggling at the moment?
The only persons who have to worry are the ones who break the law. If you do not break the law, you will not be fined. And to go back to what you said, when evidence shows that penalties has lost their effectiveness and dangerous driving persists, government has to act. We cannot be subject to a popularity contest when lives are at stake. So the government acted. And this is not, this is not a revenue exercise. If this works as intended, the government is going to collect less because there will be less violations. Please keep that in mind, sir.
Are you in a position, Minister, to give us perhaps a breakdown as to how many tickets have been issued so far for the year and the revenue generated thus far?
I don't have that information at this time, sir.
Oh, sorry. Hi, Ronessa Cutting, TV6 News. Now, some people have indicated that they were made to pay late renewal fees due to the delays caused by the inefficiencies of the licensing system over the last few days. Could you give some advice to these members of the public? Can they recoup their losses?
Yes, we spoke about this before the press conference. There are administrative provisions in place that if someone comes to a license office on the day of the expiry of their permit and they ask to come back, once they present themselves to the counter that day, they could come back the next day and pay without paying any late fees. I know numerous cases where this has happened. Other persons indicated they would have left without presenting themselves, which is unfortunate.
All right, so there's no going back now to try to get any?
Unfortunately, no.
Okay.
I'm very shocked to know how much, I'm not surprised, but how much persons are driving our nation's roads without valid permits. It's very frightening, which means they don't have insurance. It's very, very frightening now.
Now, you would have spoken to some road safety measures. I want to talk about air safety because we did see in the recent past that some international airlines would have indicated loss of signal and other concerning situations. Can you say whether any Caribbean Airlines flight had any issue at all? And also, could you give any assurance that there's absolutely no risk within our airspace and the regional airspace?
There's absolutely no risk, and I have no reports of any aircraft being affected.
Of status, the airspace is open, but what about international flights coming?
Now, what you would have seen, it was the FAA would have put out a notice to airmen. So US carriers at the time, there was some level of restrictions, but that NOTAM has since expired and flights have resumed.
Morning, Terry and Brown Campbell from TTT News. Minister Zakour, you indicated that there are 6 still demerit point offenses. Could you, because the public was under the impression that the demerit point system was completely gone. Could you explain that, please?
It's under these, we left the demerit points on these 6 criminal offenses: careless driving, driving under the influence, failing to produce a specimen, failure to do a breathalyzer test, among others.
Now, one of the things that is coming forward now is that a lot of people expect to take these offenses because some people feel as if they're being unfairly fined. And talking about going to the courts, is the ministry considering that? And they are expecting to see more court cases because of these fines?
Which fines are you talking about specifically?
The transport fines.
Now, persons have brought our attention their concerns regarding cracked windscreens and a blown light bulb, among others. This is being discussed, and I'll have more on this soon. But persons are within their right to contest at the courts.
Good morning, Kim Bodram from The Express, still on the road traffic fine issue. I think one of the things that we saw coming out of the public was that if the police are going to be cracking down, then there should be more police accountability. So, I mean, is that something that I think you have spoken about that before, ensuring that the police are also acting honestly when they, carry out their duties, and then also the issue of reckless driving, which really also requires more apparatus on the roads, whether cameras, speedometers, etc. Because reckless driving, speeding, yes, the police are cracking down, but they can only be present in so many places, and that's also a huge issue. So just maybe how your ministry is working to address that simultaneously.
Your first question, I'll prefer you ask the Honorable Minister of Homeland Security that question regarding what else we're doing regarding technology. We are working currently on a red light enforcement, where cameras will be placed on the traffic intersections throughout the country and will take photos of your vehicle breaking the light. We are working to that very soon.
Minister, I just wanted to get your thoughts on a development that occurred yesterday where we saw a coconut vendor being fined $19,000. He, articulated perhaps for some sort of grace period to pay that $19,000. What was your reaction to that?
Okay. Well, to answer your last part first, there are no provisions in the law to have a payment plan for tickets. That has to be done at the level of the courts. I was not present yesterday conducting the compliance exercise. I am not aware of the documents that would have been received by the TTPS or the documents that were not received by the TTPS. So I cannot comment further on that, sir.
I saw another case on social media. A man was ticketed, I can't remember, I think it's $10,000 for driving on the wrong side of the road. And he's saying the road is just littered with potholes. When could we expect to see some improvement in the condition of the roads?
Okay. I'm not aware of that case, but Honorable Minister John, I know, is working tirelessly to address all the issues in our nation's roads.
Dr. GOPEESINGH, could you give us a fiscal account of the NCRHA in terms of maybe how you are operating now? If it's in a deficit, what is the operating deficit? And when you expect the turnaround that you would have mentioned due to the measures that you are implementing?
As I said, when we came in, we had over 500 plus suppliers that were being owed substantial amount of money, more than $321 million. And within a short period of four months, with astute management and looking at the financial situation critically, we were able to bring down that 500 and whatever suppliers down to 120 suppliers. And we owe probably about 150 million from the 321 million that we owed. And this is as a result of the savings and the cost effectiveness programs that we initiated, particularly with security measures and for janitorial and cleaning, and also overtime reduction by about $75 million and a number of areas which we have looked into. So within a short period of time, we will have completed payments of all the suppliers. But it is critical to note these 8 top people, top companies, we have analyzed that they were given preferred attention and preferred contracts. And in the procurement department, when they used to just give one person as a supplier, because they are accustomed giving that one person and not wanting to do the work to analyze if there are other companies that will provide the same services and the same supplies with a lower cost and the same type of efficiency of the materials and so on. We are now having at least 6 to 7 or 8 quotes by different suppliers before we make a decision on what to purchase. And so we have strengthened the procurement department, we have strengthened the stores department. There was a lot of stealing in many areas. And of course, we have tried to cut down. We have moved the security services from 195 unarmed security officers down to about 135. It costs for one security officer over $200,000+ per year. So we were able to bring it down by about 40 security officers. That's alone saved nearly $10 million. The janitorial cleaning, which was about 40-something million per year, now down to about $18 million per year. And with a better efficiency and more cleaning being done within the institution. And this was across all the institutions of the NCRHA, which is Eric Williams Medical Sciences Complex, the Mount Hope Women's Hospital, Cora Hospital, Arima Hospital, Arima District Health Facility, and all the 15 health centers. So by the work that we're doing, we believe that we might be able to save about 150 million in the first instance per year from that.
All right, so I'm trying to get just the overall operating status, so to speak. You are still in a deficit, or you have been able to?
No, the Ministry of Health and the Minister of Health and the permanent secretaries have been working with us. We have been working with them We are getting our subventions on a regular basis. Where there is a shortfall from month to month, it is made up in the next month. The annual budget for the regional, you own nothing. The Prime Minister always tells us you own nothing. The Regional Health Authority, the North Central, is about 1.4 billion per year. About 900 million goes towards paying salaries, wages, national insurance, health surcharge, etc., and gratuity. So we have about 300 to 400 million for the other suppliers and for paying for other things, and which we are trying to manage very carefully. We're also looking at the staff that we have inside there. We have about 120 house officers who are on locums, 3-month contract, 6-month contract, 1-year contract. So we are trying to regularize that. Let me make this point as well. When we came in August, there are about 28 members of the complex in an exalted position, a manager's position, a top manager's position. They were brought into those positions before the election, just before the election. They were given positions of acting managers, performing duties off, and their salaries were moved from 15,000 to about 30 or 35,000, about 28 of them. And when you examine, I've been in the health sector 51 years, I'm a doctor for 51 years. And of course, when you examine what they have been doing, the operational capacity and competence leave a lot to be desired. So we are trying to clean up and work with them, improve their operational skills and what they're supposed to be responsible for. We are working with them, and we're getting better performance from them. I addressed over 500 house officers and 200 registrars the day before New Year's. They said it's the first time that they are aware in about 15 years that no member of a board or no board ever spoke to them to hear their views, to hear what they need, and we continue to work. We have over 150 consultants, 200 registrars, and about nearly 550 house officers. Their salaries come up to 330 million per year for the doctors alone. That is one regional health authority. So multiply that by 4 is about $1.2 billion for the doctors. The nurses come up to about 250 million per year as well. So right there, you have 500 to 600 million in salaries for nurses and doctors. So you understand how we have to manage that very carefully. And we're getting now better performance from the consultants. Yeah, from the consultants. Well, of course, the young house officers, they're being trained, and the registrars are taking charge now. So all in all, I think Minister Bodo and Minister Sicharan, they're very happy. We have regular meetings with the minister on a monthly basis, all the chairmen, and sometimes the deputy chairpersons. And we have regular meetings of the board. We have a number of committees that are working: quality management, finance, audit, and so on. So we on the board.
And with all of the anomalies, the irregularities that you have found, what action is to be taken? Can we expect any legal action, any sackings, what is to be done? Well,
we are dealing with the internal audits, the findings of the internal audit, and we will take the appropriate action where it is necessary. And this is why I haven't mentioned the names of any company whatsoever. But we have looked at it, and there is some degree of favorability from management, and it smacks of widespread corruption and so on, and incompetence. So where the action is needed, we will possibly take the necessary action.
All right, Doctor, let me just take the opportunity to get your perspective, if you're able to provide it, on the status of the Cuban nursing program. I know last year there was an issue that, placed a lot of anxiety in the public domain over the status of that, given these sanctions that were being imposed. Are you able to speak to that, and what's the status of the mission?
Jesse, Mr. Ramdev, we don't have any, as far as I'm aware, we don't have any nurses from Cuba or any other country at the moment. We have 2 doctors who went through the system. They came in a long time ago. One is a very good neurosurgeon, but he has got his citizenship in Trinidad. So as I'm aware now, we don't have. Then, we have the NCRHA is responsible and intertwined with the University of the West Indies. We have the medical school, which has about 750 medical students over the 5-year period. The dental schools taking 30 per year, so we have 150 dental students, and the vet school 150. Now, the nursing issue. Many years ago, Honorable Prime Minister in 2010 to 2015 made sure that we had established the nursing school in Tacarigua, which was training over 300 nurses per year. And that was moving beautifully. And when I was clinical dean of the medical school in 94 to 97, we had the nurses training school where nurses in subspecialties were being trained. And that has gone astray. It is no longer being done. So we need subspecialty nurses in cardiology, in nephrology, in neurosurgery, in accident and emergency. So all these specialist nurses that we need are no longer available. A lot who were in Trinidad migrated abroad, getting over 100,000 US per year and so on. And so this is something that I'm sure the Honorable Prime Minister is looking at to restart the program and the Ministry of Tertiary Education. We also fell very short over the last 10 years of the people who support the medical profession, like the radiographers, the ultrasonographers, the technicians, and so on. So we are short of all those because of negligence and incompetence and mismanagement. Forgive me, but the past administration for 10 years, they were sitting on their hands. And this is what Honorable Prime Minister, Mrs. Kamala Persad-Bissessar, now has to pick up with our distinguished colleagues in tertiary education and in health and so on.
So recently, the National Nurses Association was calling for prompt commencement of negotiations. Could you just tell us when they can expect?
The permanent secretaries at the Ministry of Health called a meeting of all the chairmen, all the CEOs of the different regional health authorities to update them. I understand PSA was there at the meeting, and they had over 20 members of the PSA meeting with the permanent secretary, and of course the CEOs of the RHA. The work on that, I think, is still ongoing, but we are open to whatever the Ministry of Finance and the Honorable Minister says that we must do.
All right. In closing, I'd just like to say, as we move from a country with so much lawlessness on our nation's roads to a country of compliance, we are asking the public to please work with us. The Honorable Prime Minister and the government of Trinidad and Tobago is acting in the best interests of the people of Trinidad and Tobago. So I thank you.
Thank you very much, Minister Zakour and Dr. Gopeesingh. Thank you to the members of the media, members of the public joining us online. And again, we remind you, and we, on behalf of the government, that all of our policies, as Minister Zakour said, is grounded in your safety, your security, and a better way of life. And I want to let the population see that this is a government that isn't only accounting, but we are ensuring accountability at every level. On Sunday at our press conference, we had the chairman of the HGC. Today we have the chairman of the NCRHA. So this is a government that at every level is accounting to you. So we are joined by a minister and we are joined by a chairman of a board, because that is the vision of the Honorable Prime Minister, to account to you at the ministerial level, the parliamentary level, and also at the board level, because all of these institutions belong to you. And it is the government's aim to ensure that it works in your best interest. So thank you, especially to members of the media, for joining us today. And thank you very much.
When UNC wins, everybody wins. When UNC wins, Trinbago wins. Trinbago wins. Everybody wins. Everybody wins. Tell your neighbor, tell your friend, now is the time to rise and shine. Tell your mother, tell your father, now is the time to decide. If you want leaders who can build, place your ex by the rising sun. If you want leaders who can lead properly, place your ex by the rising sun. On election day, vote UNC. One love, one team, one hope, one dream. On election day, vote UNC. vote UNC. One love, one team, one hope, one dream. On election day, vote UNC. One love, one team, one hope, one dream. When UNC wins, everybody wins. When UNC wins, Trinbago wins, Trinbago wins. Everybody wins, everybody wins. Vote for peace, vote for love, vote for hope, vote for change. When UNC wins, everybody wins. When UNC wins, Trinbago wins, Trinbago wins. Everybody wins, everybody wins. On election day, vote UNC. One love, one team, one hope, one dream. On election day, vote UNC. One love, one team, one hope.